So welcome, everyone. Thank you for joining us today for this panel organized by EiE, the Interagency Network for Education in Emergencies. My name is Jessica Yarand, and I'm a Global Program Manager at Porticus and a member of EiE, and it's a pleasure to be moderating this discussion today with you. So our theme today is strengthening the evidence base in education in emergencies towards equitable and localized knowledge generation. And we have a wonderful group of speakers with us to catalyze our thinking and hopefully our actions in this area. So with us today, we have Nadine Al-Alami. Nadine is a Programs Research Officer at Dubai Cares, managing the Evidence for Education in Emergencies research envelope, otherwise known as ECUBED. We have Kayla Bover. Kayla is the Research Manager at the University of Auckland for the Access Project. And we have Silvia Diaz-Granados Ferranz. And Silvia is the Associate Director for Education Research at the International Rescue Committee, where she leads IRC's education research agenda globally. And Silvia also serves as the co-chair of the Socio-Emotional Learning and Psychosocial Support Collaborative at EiE. So welcome to all of you. Our panel has two overarching questions that are framing the discussion today, and our speakers are going to dig into those by sharing aspects of what their initiatives are exploring and learning in their explorations. So those two questions are, how can we effectively and equitably strengthen our knowledge, not only of what works in education emergencies, but how and for whom? And how can we elevate and circulate existing knowledges and languages beyond English, as well as the knowledge produced at local, national, and regional levels? So within that frame, I'd like to ask each of you to briefly share what perspective are you bringing into the discussion today? And if you're representing a specific intervention or project, what does your project do to address these framing questions? So Nadine, we're going to start with you.
Thank you so much, Jessica, and thank you, everyone. I'm so happy to be joined by these wonderful panelists. I'm here today, first and foremost, as a learner. This is a topic that is very dear to me and is something that I have worked with my organization, Dubai Cares, to make sure is integrated into the way that we approach funding evidence for education in emergencies. And so for me, I'm hoping to be able to reflect on what we have learned from the Evidence for Education in Emergencies ECUBED Research Fund. And I'm hoping to share a little bit about the process through which we got to where we are right now, about 4 years into this envelope. But before I go into all of that, just to give a little bit more background about the envelope. So ECUBED was launched in 2017 in partnership with EiE. And it's aimed to respond to what we were hearing from the education and emergencies community, that there was not enough evidence and not enough helpful evidence for EiE at that time. And what we set out to do is create a mechanism through which we can support evidence for EiE. The way we envisioned ECUBED was that it would start through an annual call for proposals in which we would focus on supporting contextually relevant evidence that can be ultimately usable by those who are implementing education programs in emergency contexts and the communities that they work with in doing so. So in 2017, we went about this endeavor together with EiE, and we found ourselves, focusing on some of the key areas for evidence, right? So one of the things that we had highlighted was that we would focus on supporting rigorous evidence for education in emergencies. We also mentioned certain methodologies, such as RCTs being a key one for us. And we set out our call for proposals through a process where we had an advisory panel looking at and shortlisting the applications that we received. And then Dubai Cares received a shortlist of about 12 programs program proposals that we would conduct an internal review of before deciding where we would land. Immediately, I think within that first year, we realized that it wasn't going to be as simple as putting more money into supporting evidence in EiE. Because what we noticed was a big trend towards focusing on what works in EiE, where there was no indication of the perspective and the input of the people for whom this needs to work, basically. So we ended up with a lot of proposals that looked at kind of branded programs, and we're looking to see what their impact was. Now, there's absolutely nothing wrong with that, but for us, thinking about who is this evidence helpful for was a very important piece. And with that, we kind of endeavored to make sure that we are creating approaches that allow us to investigate not only what works, but what works for whom and how. I'll leave it at that. Thank you, Jessica.
Great. Thanks, Nadine. Kayla.
Great. Thank you, Jessica. Thank you, Nadine. And thanks for everybody for joining the session and for the opportunity to share on the Access Research Project, which I'll tell you about in just a second. Nadine, also, I really appreciate your perspective on first being here as a learner. So this panel and the conversation that we're having today is very important to me personally, and I really look forward to learning with you and from you all in this panel. So I just wanted to echo that. I really appreciated that and feel that as well. So I am here as the research manager from the University of Auckland for a research project called Access. Access stands for Accelerating Change for Children's and Youth Education Through Systems Strengthening. It's a 44-month research partnership between the Accelerated Education Working Group, which is a group of stakeholders working in accelerated education. It includes donors, implementing partners, UN agencies, working in accelerated education globally. The AEWG provides tools and guidance for those stakeholders who are implementing AEPs to meet the needs of overage, out-of-school children and youth globally. So Access, the research project, is a partnership between the AEWG and the University of Auckland and funded by Dubai Cares. The purpose of the Access project is to support the AEWG and other donors, implementers, as well as national education systems to understand the barriers and opportunities for integrating accelerated education programs into national education systems so that they're able to be available, accessible, and acceptable we're talking about quality here, to meet the needs of children who are overage for their grade, who have been out of school for a number of years, in order to support them to gain certified competencies and return back to the formal schools. So we're looking at the political capacity and will for integrating AEPs into national education systems, as well as what are some of the social, political, and economic constraints and enablers for doing so. And as I just mentioned, a little bit more background just to sort of understand what AEPs are, what types of education programs we're looking at. AEPs are a type of non-formal or alternative education option for those young people who are overage, usually 2 or more years overage for the grade that they are in or that they have left and would be in. They've been out of school for a number of years or never began school, and so these programs help them to acquire the certified equivalent competencies, usually of primary education or basic education. And lastly, more importantly than what it is that we're doing, is we really are looking at how we're doing that and with whom. And actually, it really resonated, Nadine, what you had mentioned about eCubed, really starting to not only look at the what and what works and how, how well it works, but really how it's working and for whom. Because as receiving funding from Dubai Cares, we really see that as an important part of our research, both in the content and in the process of our working as a research team. So the research was designed using principles of co-production with the goal of tackling power dynamics and power hierarchies both within the research and with partners that we're working with nationally and for those who this research is supposed to support. So that's really what I'm going to be speaking to today. Thank you, Jessica.
Thanks a lot, Kayla. Okay. And Sylvia.
Thank you, Jessica. Thank you, Nadine. Thank you, Kayla. I'm Silvia Diaz-Granados. I work for the International Rescue Committee at the Airborne Impact Lab, which is the Research and Innovation Unit. The IRC works in over 40 countries where people have been affected by conflict and crisis. And one of the things that we really try to do at the IRC is provide evidence-based interventions to improve the access and learning outcomes of children in these settings, because when conflict hits, the education is one of the things that primarily gets affected. So one of the things that the organization does is really try to make sure that the interventions that we provide, that there's evidence that they're effective. But one of the issues that we encounter is that there's very, very little information about what works in context of conflict and crisis. Most of the evidence that is available is evidence that comes from high-income, middle-income, and low-income settings, but stable societies. And so the IRC has really tried to put a lot of emphasis in building the evidence about what works, for whom, and at what cost in these settings. We have a global research agenda. We have been working in more than 15 and building evidence in more than 15 countries affected by conflict and crisis. And there's different things that we try to do. First, when there's little information about the context or the needs of a specific population, we conduct studies to identify, first of all, what are the needs. Before we try to identify whether something works, it is important to understand what are the needs, what are the problems, what are the specific practices that are currently taking place in these settings. Once we have enough information about what are the needs and the current practices, then we really try to engage all stakeholders, local stakeholders, in design research to try to then see what are the possible solutions and what are the possible innovations that we can implement to solve the problems that are affecting them. And so we do a lot of processes of prototyping, iterative process to try to find the solutions, but we do it in a way that is where we're co-creating things with the people that will basically be benefiting from these solutions. And once we have conducted this type of studies, which we call design research, that's where we really then try to see whether these interventions will be effective, efficient and effective. So we first design something, then we pilot these interventions at low scale to see whether the solutions that we have designed are being implemented as intended on the ground, and that with good levels of quality and fidelity of implementation, and that the assumptions of our theories of change are actually being met on the ground as we implement programs. Once we have confirmed that, that is when we then engage in randomized controlled trials, when we really try to test rigorously whether these solutions are working. So only after we have really understood the context and after we have co-generated solutions with the stakeholders and piloted those solutions, that's when we really try to test whether things work. So we have conducted several randomized controlled trials to test the impact of our interventions. And when we do so, not only we want to know whether the interventions are effective, we also want to identify at what cost, because sometimes an intervention may be effective, but maybe it's not worth the cost if there's evidence that another intervention at a lower cost is actually reaching the same effects. So the cost is important, and we have the best use of resources unit that really tries to help us to see whether something is effective, but also at a reasonable cost. And if things are not effective, then we continue to iterate to try to make sure that that we improve the effect or we reduce the cost to make sure that things are cost effective. And once we do that, we also try to understand for whom, because the interventions sometimes have different effects on different sets of children or of people. And so we really disaggregate the effects of our interventions to try to understand whether interventions are reducing or amplifying equity gaps for girls and boys, for children with disabilities and children that do not have disabilities, and as well as for displaced children and children in host communities. So the differential effect is very important to us.
Great.
I will talk more specifically about how this has place on the ground in an intervention doing in Northeastern Nigeria with support from
Great.
USA.
Yeah, we're definitely going to come back to you for more detail, Sylvia. So you've all touched on issues of, the process of learning, learning about, and also what's going to happen with the research that you're generating too. So let's dig a little bit deeper into some of that now. So Nadine, we're going to come back to you. So through the E-cubed research envelope, what approaches have you applied to support knowledge creation and sharing beyond simply looking at what works? Can you go a little bit deeper into that?
Absolutely. Thank you, Jessica. And I think that a lot of what I'm about to say, it's hearing both of you, Kayla and Sylvia, speak, it resonates with me because what Dubai Cares has focused on in the way that we have implemented E-cubed and in going towards more than just what works, full stop, was a real focus on two things. Number one is the users of evidence, with the understanding that when someone is using evidence, this is a process that occurs before we even have a research question, really. It is not about who is going to read a report that I create or what's going to happen with that report. It's about how do we position ourselves as researchers and position research really as a tool to support those who are doing the work in an emergency context to answer the questions that are relevant to them and to be able to make the decisions that they need to make, right? And one of the things that always struck me, when I think about that question of what works if it's on its own, right? Mm-hmm. If we don't have how and for whom next to it, is that we might answer that question. We might find out this works, but it might be the wrong question that we are answering because we have not heard from those who will need this evidence, who will use this evidence. We have not heard whether that is the question that they want to have answered. And that's why, Sylvia, I think your point was very relevant as well. It's about starting with that user. And so for Dubai Cares as a funder, we had to really think about how do we incentivize those kinds of approaches that center the user. And the ways we went about that, it's had a lot to do with our assessment criteria and our call for proposals. It's had a lot to do also with the ways that we have been very upfront about some guiding principles that are at the heart of any decision that we make when funding research proposals. And one of those core key principles is ensuring that those who are implementing education programs on the ground, those who are, and those they work with, they are at the center of the research process. And you'll find that also all across our assessment criteria. So our advisory panelists at E-cubed will actually check against that. The other thing that we focus on is looking at the how. And for us, the how, it's everything to do with the research process itself. We can focus on outputs that emerge from the research. We can focus on, certain effect sizes and things of that sort. But we believe that while all of that is, of course, important, it loses a lot of its meaning if it's not grounded in a very real approach and a mutual engagement with all the stakeholders that are part of this process. And so you'll see that even when we talk about evidence outputs, this is something that starts from the very beginning. We try to work with our researchers to ensure that they are generating evidence kind of on an ongoing basis and engaging with the users of evidence on an ongoing basis as well. We believe very strongly in process-related evidence. We believe very strongly in sharing learnings from the process of doing the research. And that's why, Kayla, I'm also very excited to hear about your co-creation work. And so for us, those two key areas are integrated in everything that we share as a fund, whether it is in relation to our assessment criteria, whether it is in relation to some of the ways we engage even a panel such as this one, right? I am here, I'm sitting, and I'm learning from what each of you has had to say and integrating that into how I communicate about E-cubed and how I engage with my partners. And also in the ways that we communicate and focus on grant management for each of the projects we have under E-cubed. So one of the things we've done is created a learning community for all our E-cubed researchers to ensure that we are all asking ourselves the questions that emerge when it comes to how do you do research in a way that really centers the end user. And we know there are challenges with that, and we want to work as a learning community together to make that happen. Maybe I'll leave it at that, Jessica.
Thanks, Nadine. Yeah, the criteria, those assessment criteria really came up as important, but also this idea of creating a learning community around research and pulling people in to explore with you that are going to benefit from it. So yeah, very interesting. So Sylvia, let's jump over to you. So within the research that IRC is implementing in Northeast Nigeria, I think you're going to talk about, what motivated you to engage in this design research, and what have you learned about the process? If you can dig a little bit deeper there.
Thank you. Yes, as I mentioned, we have been implementing rigorous research projects in more than 15 countries, but I'm going to talk about one specific example in Northeast Nigeria. We, as I mentioned, work in settings where children have been exposed to a lot of trauma, to loss, to poverty, and because of that, they experience toxic stress, which we know can really have a negative effect on their development. And because of that, based on evidence that exists from stable settings, we know that social emotional learning can actually have a really, can mitigate the effect that toxic stress has on that. And because of that, we really have been trying to implement social emotional learning programs in context of conflict and crisis. We know from stable settings that that works, but there's no evidence in humanitarian context about the impact of social emotional learning. Because of that, we have been conducting rigorous studies with funding from Dubai Cares, for example. We conducted randomized controlled trials in Niger and in Lebanon, and with funding from FCDO, we also conducted a randomized controlled trial in Nigeria. Interestingly, what we found is that while the programs had positive, promising effects, the social emotional learning were not having the effects that we expected and that we had hoped for. And when we really tried to understand what was happening, we understood that sometimes even if a program has the potential of being effective, sometimes there's different aspects about how humans behave and how they make decisions that can prevent the uptake of these programs. And we found that this was the case in some of these settings, and because of that, the programs were not being implemented as intended. They were not being implemented with the dosage that we wanted and the quality that we wanted. And sometimes teachers, in a study that we conducted, really confessed they had been even skipping lessons because sometimes they thought that social emotional learning programs, it was just to helping children relax, but not to really help them learn anything. Mm-hmm. Despite the trainings and despite everything that we had done, we understood that. So we engaged with support from USAID in Northeast Nigeria in a process of in-depth process of designing the social-emotional learning activities with the actors. First of all, by conducting first a phase that was like a landscape phase in which we, instead of taking a program that we know works, we identify what are some of the evidence-based activities that work in the world, and we try to engage in a very in-depth process of localizing those activities, but as well, we also try to locally source a lot of the activities that teachers and parents were already doing in their settings to teach some of the skills that they valued. So we try to identify what are the skills they will value, what are the skills they want to teach, and also what are they already doing to do that. Based on that, we created and spent a few months working with a set of teachers to really design and prototype and iterate those activities so that they would be clear, relevant to the context and feasible to implement so that they would actually do that. And we did that using behavioral insights, behavioral science, which is the science that really tries to understand why people make certain decisions, because sometimes we know that a program can be effective, but it's not being implemented as intended. And so we use principles of that, and then also principles of human-centered design to really involve all the stakeholders throughout the process in the designing of the content, designing of the trainings, designing of the incentives, all of that. And so it was a very collaborative process with teachers and caregivers in Nigeria. And once we finished that phase of design research, we moved on to pilot that. So we just finished the implementation research phase where we really were able to test our theory, the assumptions of our theory of change. And we were able to confirm that, yes, teachers understand the program, they're implementing it as intended with the levels of quality and fidelity that we expected, and more also understood that they now understand why they're doing that and the relevance to their context and to their teaching practices. So now we are about to move to the rigorous testing, starting to do randomized controlled trials to then evaluate, after we have finished the implementation research, evaluate that the program is having actually the effects that we anticipate they will have and changing students' academic and social-emotional learning outcomes.
Thanks, Sylvia. Yeah, bringing the teachers in the community, building on what's there, really important learning that you're sharing here. So thank you. And Kayla, so come over to you. So in Access, how and with whom are you co-creating the research? And are there any ways that you would improve or enhance that process of co-creation?
Yeah, thank you, Jessica. Yeah, this question is really important to me, and actually the way that I think about it is actually in relation to two different points, one which Nadine had spoken to earlier, and that is really around thinking about, both not only what is working, but how and why, and thinking of it from the perspective of what is sort of the end goal of the research? Who's going to be using the research? What are they going to be using it for? And then what do they need to know in order to be able to accomplish their objectives? And that's sort of the first point. So Access has really built on several years of research on accelerated education previously. My personal perspective and my familiarity goes back to an important study conducted by the University of Chicago, the NORC Center. I can't quite remember if it's how to call it, but that was research funded in 2015, and that was looking at the effectiveness of accelerated education programs, really asking questions around what is working, and looking at some of these more rigorous studies. And what the conclusions of that study sort of for the Accelerated Education Working Group helped us to realize is that there wasn't a lot of information around sort of what's working. And then we continue to sort of build on that, developing a learning agenda as the Accelerated Education Working Group. And thinking about sort of what's working, but more importantly, how and why and for whom. We started conducting a series of research projects over the course of several years, beginning with some case studies in 2017 and an updated evidence review. And we continued to find through those research projects, not only is there a lack of evidence around what is working, but really that question of how it's working and why. And so the Access research is really trying to dig into that how and why and for whom research, with the idea that we could have all of the technical guidance in the world around implementing accelerated education programs, but if it's not contextualized, it's not designed to address the specific political, social, economic context that it's working in, we're not going to see the outcomes that we want for overage, out-of-school children and youth. The second component is the research process. The research for Access was designed in collaboration between the AEWG, the University of Auckland, and with the support of Dubai Cares. When we selected the 5 countries that we're going to be working in, which I'll briefly mention are Uganda, Nigeria, Pakistan, Jordan, and Colombia. There we go. Once we had those researchers on board, we really worked with the researchers to refine the research questions and the methods that are relevant for their specific contexts. So the Access research had sort of an overarching vision and overarching framework, but the research is truly that of the researchers in their contexts. And so we wanted them to really take the research project, make it their own, make it useful for national education stakeholders in their countries. Building on that, so this 44-month research project is two-phase. We're coming up at the end of phase 1, which is a political economy analysis, looking at some of the opportunities and the barriers within the political and economic context to integrate AEPs. We're going to then be moving into phase 2 in the coming year, where we're going to be conducting action research with national education stakeholders. And we're going to be working with those stakeholders to support them to prioritize the challenges, the issues, the questions that they want to address in relation to integrating AEPs into their national education systems, developing action plans, and working to solve it. The question, though, around what areas to improve, I think, is something that's really relevant to our project. And, one of the things that we realized towards the end of the first phase of the Access research is that we're really not well capturing the voice of the children and youth who are out of school, who are over age, who AEPs are intended to benefit, who, when we're looking at availability, access, acceptability, are best able to speak to whether the AEPs are meeting their needs in those areas. So while we're ending the phase 1 of the research, moving into phase 2, we're trying to think about how we can involve the youth, the out-of-school children who would participate in AEPs in the research. We're looking at engaging civil society organizations, self-advocacy groups for youth, girls and women, learners with disabilities, teachers unions, and others, in addition to the national education, ministries of education, other national stakeholders involved. And so that's just sort of one of the ways that we're looking to improve in that area. Thank you.
Great, thanks, Kayla. Lots of actors involved in that research project. So speaking of that, I'm going to ask all of you the same question. And Kayla, we're gonna stay with you to start and just dig in a little bit deeper. In this question, can you share some reflections about that you and your initiative have had, that you and Access, in your case, Kayla, have had about power dynamics that are inherent in your project? And what have you done, or what would you do, could you do to redress those?
Great, yeah. So thinking about this sort of brings up two different levels or two different sets of relationships in the Access project. One is within the research team, and with our partners, including the AEWG and Dubai Cares. The second is with the participants in the research, which to now has primarily been national education stakeholders, donors, implementers, UN, and others, but in the future hoping to better include youth and out-of-school children. And so that second layer is how we're trying to engage with participants and those who the research is intended to benefit. Mm-hmm. So with the research team, I spoke a little bit about the design flexibility, and when we selected the 5 countries, we had that overarching framework for what the research would look like, but then we really worked with the country researchers to make it their own research. And that's one of the ways that we're trying to sort of address this. We're not trying to say, okay, here's our research design, go out and collect data, come back, report to us, and tell us what it is, and we'll write it, and then we'll stamp our name on it. Past experience in research in education and emergencies, that's often the case. And so we're really trying to support the researchers to make it their own, to make it relevant to them, to make it something that they're able to own. We've also tried to work with the researchers and with the whole research team in sort of a flat management type style. As the management team, as the research manager and the principal investigator, we try to, not direct and tell the researchers what it is that they need to do, but rather to sort of be behind the scenes and support them, and rather have the researchers provide their expertise and their support to one another, and their I like to call it critical friendliness. So to sort of be able to critique and comment to each other on how they might improve on their research. And then lastly, within the research team, really thinking about presentation, sharing of the information writing. So who is the one that's communicating to whom, about what, in what language is some of the questions that we're asking, and really trying not as, the management team to be presenting the findings of access, but rather having the researchers do that themselves. In relation to the participants of the research, as well as out-of-school children and youth, really thinking in phase 2 about how to do that using a participatory approach to action research. But beyond that, we'll be recruiting and hiring a national coordinator who's going to lead that process. We'll also be engaging with a wide range of stakeholders at the national level to engage in a task force. And it's really these local stakeholders who are identifying the priority challenges and developing the action plan and taking those action plans forward. So we're really there to document the process, to provide technical assistance from the side of the AEWG, but we try not to push forward any specific agenda or process.
So
Thank you.
ownership is what I
Yes.
heard. Like, this is ours and not
Absolutely,
yeah.
not ours.
Not
yeah.
ours, but ours.
Yes, exactly.
Great.
Yeah,
Thanks a lot, Kayla. Sylvia, coming over to you. Your reflections on power dynamics.
Yeah, we definitely have been having a lot of reflections around that, and there are two main things that I think we are doing. First of all, at the level of identifying the problems and developing the solutions, we really are engaging with the direct beneficiaries of our interventions so that we address the things that are concerning to them, not to us, but to them. To really try to understand what are their needs and what are their problems, and also to try to identify what are the solutions that they themselves are developing to try to address those problems. And so, and as well as co-creating with them and sharing other things that are working from other contexts, but we are putting really a lot of emphasis on locally sourcing the solutions and also co-developing solutions with the direct beneficiaries of the work. So that is at the level of designing solutions, but at the level of testing the solutions and conducting the research, like who is generating the knowledge, we're really also doing a few things. First of all, we have noticed and we have seen, and we have ourselves in the past also used to conduct the research by big names in the global north, but in our research projects, we're currently really engaging local researchers as principal investigators and as co-investigators, and so we work with them and they conduct the research so that it's the local people doing that. But in addition to that, we're also creating research steering committees that involve a lot of local stakeholders, practitioners, donors, policymakers from the beginning of the research process, so that basically even at the level of identifying the research questions, we're negotiating with the local stakeholders what are the questions that are actually going to be relevant for them and that they're going to inform their own decisions, as opposed to waiting, which used to be traditional practice, waiting until the research has been done and finalized to actually disseminate results. For us, dissemination doesn't begin at the end, but from the very beginning of identifying research questions. And so we have research committees that are where we invite a range of local stakeholders to advise us, to identify those questions, and then to help us interpret the preliminary findings at different stages of the process, to interpret them, to help us think about interpretations and implications, and such that basically they will they're guiding us in the process with researchers that are also locally sourced.
Yeah, great. So building really, I'm hearing a lot like foundation of the community again from you, and not just capacity building on the creation of intellectual capital in that space, but really, yeah, like your capacity is.
Yeah, we don't talk anymore about capacity building.
Yeah.
We're talking about capacity sharing. We are
Capacity
learning
sharing,
from them,
yeah,
and they're
great.
learning from us. And so we basically have relationships that are peer relationships.
Fantastic. Yeah, thank you. Nadine, over to you for the final thought on power dynamics before we have to end.
Thank you so much, Jessica. I'll start with one thing, which is an acknowledgement of the fact that EQT works in partnership at so many different levels, whether we're talking about our partnership with EiE, our partnership with our advisory group, or our partnership within our research projects. And I'm sitting here with a couple of our partners, but then also our partnerships, right? And we have been navigating, of course, the most obvious of the power asymmetries being that Dubai Cares does hold the funds and that decision making. And that is one thing that we have been navigating. But beyond that, it's also about how we work with our own project partners and how we enable them to, or work with them to reflect on their own power asymmetries. I want to go into that a little bit, and I want to frame actually the discussion using some recent findings that have emerged from a research project funded under eCubed, led by Francine Menashi, Zina Zakaria, and Maha Shaib. And this was a research that looked at partnerships in education and emergencies, specifically looking at the refugee education response in Syria. And it looked at what were the key conditions that supported ethical and effective partnerships in EiE, the kinds of partnerships that have stayed strong despite multiple crises that they had faced. And a few things that came up, there were 5 key principles that came up. The first was a focus on care, moving from saviorism, which is something that we've all dealt with, into care. And what that means is really the intangible elements of how we engage as humans with one another. And what we found is that when you engage human to human in a project, this allows for the kind of vulnerability and the kind of openness that would support a strong partnership. And this is something that we do at that level with our own partners as well, whether it's like a quick WhatsApp chat or just a check-in. And then the other bit is looking at trust and respect. And what that means when we talk about trust, noting that we might come into a project with different goals and different values, and that we can trust that each of us, with these values that we have, we can be capable, we can be strong, we can be resilient, and we can get to what is needed to continue this work. This is something that we engage with a lot at Dubai Cares every time we talk about change with any one of our partners, right? How do I come into that from a place of trust and from a place of respect that even if we have different goals, we are in this together within the project that we are working on. Then looking at kind of more organic and ongoing communication amongst one another. We talk a lot about having quarterly calls and things like that. A lot of the times what makes partnerships strong has been about the times that you have an unscheduled check-in with a partner and moving from there. The other piece is mutual learning, and I mentioned that a lot. We have a learning community. We are very open to change. If one of our partners tells us, look, we've been learning this from our project, we take that on. We position ourselves as learners and we engage in that way. And then finally, and on that topic of power, understanding and recognizing the power asymmetries that lie and knowing that if I ignore it, it doesn't mean that it's gone. And it is an ongoing process. I have to continue to reflect and continue to engage in maybe something uncomfortable for me as an individual, but that would allow me to address some of the power asymmetries. I'll leave it at that, but I did want to ensure that we focus a little bit on some of the things we've been finding out about partnerships.
No, thanks for that, Nadine. And that point you made about trust and vulnerability being at the heart of partnership and the capacity sharing that Sylvia mentioned, fantastic. So unfortunately, we are about out of time. In 20 seconds, can I ask each of you, Sylvia, what's the message in 10 seconds, 20 seconds that you want to leave the audience with?
Know your context, engage, create genuine partnerships with the local actors, and then build the evidence to ensure that children have access to the best education they can.
Great, thank you. Kayla, 20-second message.
I would say make space for reflexivity on the research team and also recognizing that participation of quote-unquote beneficiaries is a right. It's not an add-on.
Great, thank you. Nadine, last word to you.
Sure. I'd say understand that this takes a lot of resources and a lot of time, but it is necessary. And put in all the efforts that are required to engage in this process in the way that it deserves.
Thank you so much. Unfortunately, we're now out of time, but thank you so much, Nadine, Kayla, Sylvia, for sharing these thoughts. Thank you for everybody who's joining us for the conversation in person and also virtually, and wish you all a good day and a good experience at Rewired. Thank you so much.
Thank you.